Chemo-induced alopecia does, cause a lot of stress. It's associated with lower quality of life. Scalp cool may really help improve quality of life. And even some studies have shown that women in the scalp cooling group felt less upset about losing their hair and less dissatisfied with their appearance compared to the women in the control group that didn't receive any scalp cooling. So a lot of these studies are showing that does have a very positive impact on psychosocial feelings and side effects in relation to overall cancer treatment.
You're listening to the ONS podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. The advertising messages in this episode are paid for by Paxman. For many, the out-of-pocket cost for scalp cooling is a barrier to treatment. But with CPT Category 1 codes launching January 1st, 2026, equitable patient access is now within reach. Find out how you can support scalp cooling coverage for your patients at paxmanusa.com/IBBM. Hello and welcome to the ONS podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice here at ONS. And today we're talking with Jaclyn Andronico, Clinical Nurse Specialist at Memorial Sloan Kettering Cancer Center in New York, about chemotherapy-induced alopecia and scalp cooling. Welcome, and thanks so much for joining us today, Jaclyn.
Thank you for having me.
Chemotherapy-induced alopecia is probably one of the most sort of globally well-known, feared side effects of cancer treatment. Can you explain a little bit just about that underlying process of what causes chemotherapy-induced alopecia?
Sure. So chemotherapy-induced alopecia, we also can call it CIA, is caused by cytotoxic drugs that kill rapid proliferating cells, which are not always the cancer cells, but also healthy cells, such as our hair follicles.
And what classes of chemotherapy or specific agents do we typically associate alopecia with?
Some of the classes that are high risk for chemotherapy-induced alopecia can include anti-tumor antibiotics such as doxorubicin, epirubicin, antimicrotubule drugs such as taxanes like docetaxel, paclitaxel, alkylating agents such as cyclophosphamide. The lower risk alopecia causing chemo agents are the antimetabolite classes, which a lot of people know as gemcitabine or fluorouracil. We also are seeing patients experience some degree of alopecia with a drug called sacituzumab govitecan, which is an actual antibody drug conjugate. And we were seeing a few of those as well.
Yeah, it's interesting that you say that, we'll be focused on sort of chemotherapy-induced alopecia, but I do know that, we do see hair loss associated with some other sort of not classical chemotherapies as well, though I assume the mechanism of action for that might be slightly different. But just important, I think, for our listeners, all nurses to be aware that while it's typically associated with chemotherapy, we are seeing it sometimes pop up less frequently, but still happening with other types of agents as well.
Yes, and that's a newer agent. So we're seeing that about 50% of patients are losing their hair with it. So really trying to understand the scalp cooling and how that plays a role in helping mitigate that side effect.
Let's talk a little bit about the incidence. What is the incidence? How often does it occur in patients who are treated with these types of chemotherapy?
Yeah, the risk and incidence of chemo-induced alopecia and degree of hair loss can differ based on the patient's type of chemo, the dose they're getting, the frequency and duration. So, for example, microtubule agents like Taxol, there's a higher chance, which is around 80%. For anthracyclines, such as doxorubicin, even higher, we see between 60 and 100% of hair loss. And then alkylating agents like cyclophosphamide, it's around 60% as well. If a patient ends up getting a combination therapy, which is multiple chemotherapy agents, this can then further increase the incidence of the chemo-induced alopecia.
Now, when we think of all of the potential toxicities and side effects that we know chemotherapy and other anti-neoplastic agents can cause, this is one that is not harmful in sort of the risk to life sense. But, I have very vivid memories of patients who opted not to get a certain treatment because they did not want to lose their hair. So to say that it's not a big deal is certainly inaccurate. It does matter. It's important for patients, for some patients. And so while it is maybe just a change in their outward appearance, it has other impacts to patients. So can you talk a little bit about what are those effects for patients? How does it impact them psychologically, psychosocially? What does that look like for patients?
Chemotherapy-induced alopecia has a lot of significant negative impacts on patients, such as their self-esteem, their body image, their sexuality, and the overall quality of life. Hair is connected with a person's general well-being, their sexual attraction, their social status, and just other meanings within their life. A lot of psychological stress, such as anxiety, confusion, depression in young women and men, has been seen when they experience chemo-induced alopecia. One study showed that out of 179 patients, both male and female, 101 of them said hair loss was the worst side effect of their chemotherapy treatment. And then another study conducted on this issue with the participation of female patients, 47% of those patients identified alopecia as the most dramatic side effect in their treatment regimen. And in addition, so one study said that 8% of patients, they declined chemotherapy because of the alopecia side effect.
Well, and I really appreciate you highlighting that this is not just something that women experience if they are receiving chemotherapy and risk alopecia. This is something that we should assume that it affects all patients equally, or at least the potential is there for them to be concerned about it or to be bothered by the possibility of losing their hair. And so certainly important for us as nurses to keep that in mind as we're counseling patients and to not just assume that, oh, if this is a man, he's going to lose his hair and he'll be fine with it. I admit that might be a bias that I hold. So I think that that's important for us to remember.
Yes, definitely.
So let's shift gears a little bit and talk about preventing alopecia with scalp cooling. Can you give us just an overview of the history and kind of the process of scalp cooling and how it's kind of unfolded in oncology?
Yeah, scalp cooling has been around since the 1970s, actually, and was very popular in the rest of the world, such as in the United Kingdom, France, and Netherlands. It then made its way over to the United States around in 2015. Scalp cooling options included cooling machines and cold caps. The first U.S. Drug and Food Administration cleared the first machine-based cooling system for solid tumor adult patients called Dignitana. And then a second company equipment called Paxman scalp cooling system was cleared in April of 2017. And over the years, scalp cooling popularity has really grown across cancer centers in the United States. There is evidence that scalp cooling reduces the uptake of chemotherapy agents, as we described before, although the exact way on how it does is still unknown. It's thought that the vasoconstriction from the cooling reduces the metabolic rate of the hair follicle cells, and which in turn reduces the drug uptake of the chemo in that cell and then helps with lessening the cell division. The process of scalp cooling starts with the discussion between the patient and their healthcare team about scalp cooling. When it's decided to move forward with the scalp cooling, the patient may choose to use either an institution-driven scalp cooling program with a scalp cooling system or a patient-driven program such as the cold caps. The patient's healthcare team will size the patient on the cap. There's different sizes, either small, medium, or large. And then the appointment will be created for the patient to get the cooling done in the infusion area where they'll be receiving their chemotherapy infusion. The scalp cooling system is like a compact little refrigerator where it contains the coolant that is circulated through a cooling cap. The coolant will pass through the channels to the cap, and the cooling will occur for the immediate use to the scalp. The patient will complete the pre-cooling phase prior to getting the alopecia-inducing chemotherapy agent. Then they'll cool throughout the infusion of the drug, and then they will cool after the completion of the chemotherapy. The timing of these can vary according to the vendor's recommendation and then the treatment regimen as well. Typically, prior to the administration of the alopecia-inducing chemo, the patient will cool for around 30 minutes prior. The cooling continues throughout chemotherapy administration. And then during the post-cooling period, it could be either as short as 20 minutes or as long as 90 minutes. If a cold cap program is decided instead of the cold cap system, the patient obtains the cap and supplies from the vendor, and the pre and post cooling is individualized to the patient, and the patient brings this to the unit where they're getting their chemotherapy treatment. Usually multiple caps are needed and swapped out throughout that time frame, and that can be done by either a caregiver or a hired capper that will apply and change the caps before, during, and after the treatment.
Thank you for that very comprehensive overview. I think not every nurse has experienced and helped with patients that have received that. So that was a really helpful kind of walkthrough of what that process looks like, both for patients and nurses who are caring for them. So for patients who are considering if scalp cooling is something they want to pursue, what makes a good candidate for this procedure? And are there any contraindications or any diagnoses that would not be good candidates for receiving scalp cooling?
Yeah, so scalp cooling is approved for solid tumor patients receiving chemotherapy agents, as we discussed before, with that high incidence of chemotherapy-induced alopecia really should be considered for scalp cooling as long as they don't have certain contraindications. So some contraindications do exist for these populations. Those are patients that have like cold agglutinin diseases, cryoglobulinemia, cryofibrogemia, and any cold sensitivity issues. Patients also with like abnormal liver functions are not suggested to receive scalp cooling because their liver function is associated with the metabolism of the drug agents. It's also not recommended for patients with hematologic malignancies who are higher risk for cutaneous metastatic disease or failed chemotherapy or even reduced survival rates. However, the chemo doses for the patient with the hematologic malignancies are usually 5 to 10 times higher than those for solid tumor. So they end up having a lot of permanent chemo-induced alopecia with those types of patients. So just to be aware of that. And lastly, anyone with like a central nervous system malignancy, or if they're on treatment with the drug oxaliplatin, and any existing history of scalp mets or patients with skull radiation are also contraindicated with scalp cooling. And just to be mindful about that when looking and selecting the patients, or if they're inquiring about scalp cooling prior to starting treatment.
And so when we're talking with patients and counseling them on the possibility of using scalp cooling, certainly we want to make sure we're portraying the efficacy, how likely it is to work or how well it's going to work. So what does that look like for patients? How well does it actually help prevent or mitigate alopecia?
Yeah, there's a large amount of evidence out there showing how scalp cooling really does help prevent or reduce chemo-induced alopecia. One trial with early stage breast cancer patients receiving 4 cycles of the taxane and or anthracycline-based chemo, the scalp cooling group succeedingly reported 50% of women compared to 0 in the control group were able to retain their hair. And a lot of these studies show effectiveness through measurement tools such as the World Health Organization criteria or the CTCAE, their need for wigs, scales for their hair loss, visual analogs, and patient self-reports. In another study by Zhang in 2022, their review showed scalp cooling was the most common and effective method in chemo-induced alopecia. It showed to reduce the risk of severe to total alopecia from 5 systemic reviews that conducted a meta-analysis. So the literature is out there and very thorough in showing how scalp cooling is mitigating that alopecia causing side effect in chemotherapy drugs.
Well, and I think also the reality is that we don't have anything else that is used to treat this. There's nothing else out there. And so I'm sure many patients will, if this is really important to them, then the possibility of it working at all is better than trying nothing. But that's great to know. Hearing all those studies of just supporting the efficacy is great to hear. So when patients are undergoing their scalp cooling, what is their experience like in terms of tolerability? How do they do? And are there any safety concerns that patients should be aware of or nurses should be monitoring for?
Oh, yeah. So overall, scalp cooling has a good tolerance, but it's important to be aware that scalp cooling can be uncomfortable for some, and it isn't always tolerated by some patients. Patients have reported side effects such as headaches, dizziness, chills, cold sensations, scalp pain, head discomfort, and even claustrophobia. Among these, the most common is the cold feeling and headaches. So when caring for patients that undergo scalp cooling, the nurses really should recognize the patient's feelings and help relieve that discomfort with position changes, prophylactic painkillers such as Tylenol or Motrin if they're allowed to take that, additional warm blankets, even anti-anxiety medications can really help, especially if that claustrophobia feeling is there. So collaborating with that team, the doctors, the NPs, just to be aware that if the patient's not comfortable during this treatment of scalp cooling, they should have those things on board prior to starting. Some safety concerns with scalp cooling was first introduced. There was a real risk for scalp mets, and that really deterred usage with scalp cooling. But there's been extensive research that shows that scalp cooling is unlikely to have adverse effects, especially in the incidence of scalp mets and overall survival. So although the scalp cooling is established safe in the solid tumor patient, it's still not allowed in the hematologic malignancy patients because the research is not there yet about the scalp mets. But for solid tumor, it's a very safe and effective treatment for alopecia.
The advertising messages in this episode are paid for by Paxman. Does your facility offer scalp cooling? CPT Category 1 codes for the treatment are almost here. Paxman's insurance-based billing model enables you to offer scalp cooling with fully reimbursable workflows. By billing insurance directly, you can help those going through cancer treatment to access scalp cooling without financial toxicity, opening the doors to greater access to this treatment for your patients. Learn more at paxmanusa.com/IBBM. So for our patients that are able to access scalp cooling and they do use this during their treatment, how does that impact them psychologically and psychosocially?
It suggests that the chemo-induced alopecia does, cause a lot of stress. It's associated with lower quality of life than early recovery from alopecia in patients that scalp cool may really help improve quality of life if the patient does scalp cooling. And even some studies have shown that women in the scalp cooling group felt less upset about losing their hair and less dissatisfied with their appearance compared to the woman in the control group that didn't receive any scalp cooling. So a lot of these studies are showing that does have a very positive impact on psychosocial feelings and side effects in relation to overall cancer treatment.
And so you originally mentioned that there are options in terms of the systems or the products that are used to do this. What is the typical process for a patient to actually access a scalp cooling system with their therapy? Do they need a prescription? Does it require insurance coverage? And what are some of the barriers that patients might face when they're trying to access scalp cooling?
So there are several institutions across the U.S. that offer machine-based scalp cooling. Even though we know that scalp cooling is effective, a lot of times, unfortunately, the cost has reduced its availability to certain patient populations. But in 2021, the American Medical Associate introduced 2 current procedural terminology, also known as CPT codes, that allowed providers to bill insurances directly for scalp cooling, which is great. And then in 2022, Medicare and Medicaid created a payment rate for scalp cooling. So currently, Medicare and Medicaid cover scalp cooling, and following in suit, a lot of private insurance companies are also starting to cover this service. And so as a result, many healthcare institutions are now moving from a self-pay model to an insurance-based billing model. This in turn has created more access for patients in scalp cooling. So really, once the decision's made with the healthcare team and the patient that they'd like to scalp cool, and if they are on an insurance-based billing model, this is when the healthcare provider will put a prescription in for scalp cooling. And then the institution, if they're on the insurance-based billing, will actually purchase, store, and then administer the product and service to the patient, which is the scalp cooling kit and the machines. The healthcare providers will use the 2 CPT codes to bill the insurance companies. And once the discussion of the insurance coverage is completed, the patient then works with the financial team at the institution, and the healthcare team, including the nurse, will size the patient for a cap and give the patient the kit that was provided from the institution, which contains the cap and any necessary supplies ready for cooling. When the healthcare team documents the sizing of the cap and their first appointment with the patient, their first CPT code is then generated, and then the insurance company is billed. And then when the patient goes to the infusion unit and the scalp cooling device is used, the infusion nurses are documenting, and another CPT code is then generated with a chemo administration code. This occurs each time the patient goes to the infusion unit and uses their kit. So this is a great way in tracking this and helping with the insurance-based billing model. If in the case the patient does not have their insurance cover, it's great to have institutions where they have a patient financial service department that helps find alternative means for the patient, with such as financial assistance. There's great options out there. I know Paxman Scalp Cooling Assistance Program is available. Hair to Stay is a great program as well. Or the Rapunzel Project, all offer financial aid to patients who may not have access to the insurance-based coverage, and they can use that as a resource as well. There's also a great article written, and I was actually co-authored by my colleague, Andrea Smith, who is the team lead for our scalp cooling program here at Sloan Kettering Cancer Center. It's called Expanding the Availability of Scalp Cooling to All Patients at Risk for Chemotherapy-Induced Alopecia. This article really discusses the implementation, the benefits, and the value of insurance-based billing model compared to the self-pay model. I would encourage everyone to read it if your institution is really moving to an insurance-based billing model from a self-pay model. It really helps identify what you need to do to be successful in offering that to patients.
That's wonderful. And we'll be sure to include links to some of those organizations that you mentioned in terms of supporting patients. And then also that article sounds like a wonderful resource as well. So for nurses who are caring for patients who are going to be pursuing scalp cooling, what are some of the primary education points that we should be prepared to share with patients to make sure that they and their caregivers are ready for what's to come?
A lot of primary education points for nurses to review with patients is explaining the financial reimbursement process and assistance options, collaborating with that financial department within your institution. Also discussing the efficacy of the scalp cooling and the tolerability of it as well. I don't know if patients are always aware of the feeling of the cold, really warning them, letting them know what they're going to experience while in the chair attached to that cooling machine. Review how scalp cooling works and what to expect in the infusion unit. Some of them aren't aware that their infusion appointment will be a lot longer now because of the cooling pre and post. So just being aware of that, having them plan ahead, explain and review the post-cooling times so they're aware, and then reviewing the hair and head care, such as avoiding harsh chemicals. They really should avoid processing hair, any bleach. They should really decrease the frequency of washing their hair. Again, a lot of these companies do provide these instructions on their website or in the kits, So just being aware that they should be reviewing those things because, they should take ownership of this and making sure that the patient feels supported and they have the resources to make this successful. Also, they should really learn how to practice to place their own cap and prepare their hair prior to going to the infusion appointment and getting scalp cooled. It's a long process in getting the cap on, using conditioner, making their hair wet. So it's important that they know to do these things prior to and really taking that ownership of it. And then also if they have questions, when to call the office, who to speak to, what are some of the resources out there? I know there's a great Facebook support group that Paxman offers and being aware that that's there for patients to use and collaborate with the community for scalp cooling. Just knowing those resources are available and teaching patients to use them.
And then finally, what about nurses? What should we know about it, or how can we make sure we are educated and familiar with what is all involved in providing this treatment to our patients? What are some of the nursing education gaps that we need to try to overcome about scalp cooling treatment?
Nurses, we're at the forefront of scalp cooling, and we manage a lot of this area that comes with the service. They are managing the coordination of the care, the education. They're assisting with that financial discussion and collaborating with the financial department, the symptom management. They're helping make the patients feel more comfortable with the symptoms of scalp cooling. They are the real deal here. So they are the best in helping with this situation. Nurses should be really familiar with the efficacy again and the tolerability, the contraindications, the side effects and the cost, and even the access for scalp cooling. I think there is education gaps that lie with these new financial models out there, such as moving from the self-pay to the insurance-based billing as this continues to evolve. It's also a new process, so everyone's still learning. Now with Medicaid covering scalp cooling, there's a lot more private insurances following through, and that's going to become a little bit more complicated for the nurses, especially if they're teaching and they're trying to help ensure the patient gets coverage and access. So for example, at MSK, we developed a pretty large-scale education initiative to ensure nurses were familiar with the changes from self-pay to insurance-based billing. We developed efficient way for nurse to contact the scalp cooling team here that led the education in case these questions came up and they weren't sure of. One of my colleagues, like Kuku Como, a clinical nurse specialist at the Evelyn Lauder Breast Center, who's an expert in scalp cooling, she facilitated and organized many of these education sessions throughout the entire organization. So the nurses felt very supported and confident with this change in our workflow. And they contacted her and she was always available for these questions. And she really helped to really create a very sane workflow here at Scalp Cooling in addition to Andrea. So with more and more private insurance companies covering, this will only increase the volume within the clinics and infusion units with scalp cooling. So that's something also to be aware of with nursing. This can lead to more technical support of the devices we're using and just the overall workload and scheduling of the service. Healthcare organizations across the U.S. can really incorporate this into their workflow, and nurses should recognize that there's a lot of positives to insurance-based billing, especially that it takes the burden off the payments off the patient who are under a lot of stress already with their parts of their treatment. So it gives the patients a good control over their chemo-induced alopecia, and most importantly, it really increases access to patients that did not have the financial means before to get scalp cooling, which I think is really important. And then nurses really should be, again, aware of that financial assistance programs out there that I mentioned. Those are just a few. There are more, and really collaborating and trying to get those resources out to their patients in case finance is a big deterrent for them for scalp cooling.
Well, Jaclyn, thank you so much for joining us today. We've certainly covered a lot in a short amount of time, but I certainly have learned more than I knew before about scalp cooling. And I really hope that our listeners, if they're working at an institution or at a program that maybe doesn't offer this or maybe isn't offering it with like the insurance-based billing, as you've mentioned, hopefully this will give them that inspiration to really investigate it and perhaps be that champion that their site needs to help make this more accessible to their patients. So thank you for all the great information that you've shared. As we get to the end of our episode today, we like to always run through with just a series of some quick fire questions to help summarize some of the great things that we've discussed. So to start that off, how do you think healthcare professionals should evaluate any of their own hidden or implicit bias that they might have about alopecia and scalp cooling?
I think they have to be aware that, scalp cooling isn't just for women, it's for men, like we discussed earlier, and that you may not feel that it's a very important side effect in the large scheme of side effects of chemo. I think people focus on the nausea, the fatigue, the neutropenia, but alopecia is a huge psychological impact on patients. I know from my experience, patients have expressed concern to me in my practice that what is my family going to think when they see me lose my hair? What about my children patients who have young children or grandparents with young grandchildren? So it is a huge impact on their psychosocial well-being, and that in turn is just as important as their physical well-being. So just for healthcare professionals to keep an open mind if patients are very concerned about chemotherapy-induced alopecia and are very interested in scalp cooling, to really find ways for them to gain access to this and support them in that.
What are some common misconceptions about alopecia and scalp cooling?
Some common misconceptions about alopecia is that it's not as important as the other side effects of chemotherapy and that patients can just live with it. And, I think that's a big reason insurances maybe didn't cover the scalp cooling because it wasn't a necessary side effect. But we're seeing more and more how big impact alopecia has on their psychosocial well-being. So I think making sure that we are, as clinicians, assessing that and making sure patients are feeling supported, especially during their hair loss during treatment. And then if scalp cooling misconceptions, I think a lot of people feel that it's not necessary and that it's not as important, and the process of getting to it is tedious, but I think it's not as tedious as we assumed it to be. It's a very straightforward process and it's important, and patients should get that access to it. And I think more and more states are recognizing that and insurance carriers are recognizing that. So I think just trying to relieve those misconceptions is important.
And is there anything about this topic that you don't think is discussed enough and you wish people knew more about?
I think people need to be aware that the access is now being more and more available to patients, and that's very new in the upcoming year. So to be aware of that, and that how we can get our institutions to integrate scalp cooling programs to patients so that they have the access to it, and making sure they are feeling empowered when they start scalp cooling and the education is available to them and the support is there as well.
What additional training or education do you think oncology nurses need to stay current on this topic?
This is an ongoing specialized training and education. They definitely need training on the devices when they're in the infusion areas. The nurses in the clinics need education on the fitting procedures. Not everybody is a small, medium, and large, kind of like pant sizes. We're all in between sometimes. So being aware of how to make sure the cap fits correctly on the patient's scalp, because that in turn does impact the results. So really that hands-on demonstration, troubleshooting techniques, patient selection and prep, and just being overall knowing the continuing education that's needed with scalp cooling, knowing the research. We're seeing more drugs that were not typically straight chemo agents that are now causing hair loss. So for example, that sacituzumab we mentioned earlier, just really knowing more and more about scalp cooling and keeping yourself abreast of those updates.
And then finally, what are additional resources that you would recommend for patients or other providers who want to learn more about scalp cooling?
Oh, yeah. So additional resources is knowing those programs that are out there, that financial assistance programs for patients if they are interested in scalp cooling. We work very closely with Paxman here at MSK. So they have a wonderful website that's available to providers and patients. They have videos. They also have a Facebook group that's very helpful for patients to feel supported in the community of scalp cooling. So just to be aware that these resources are available. And Oncology Nursing Society has wonderful resources as well. So just to be aware of where these things are and keep looking at them and making sure you're kept up to date with these new developments as the years go on.
Outstanding. Well, Jaclyn, thank you again so much for joining us on the podcast today and sharing all of the great information and your success in seeing this program come to life at your institution. Do you have any final comments to share with our listeners?
Thank you so much for this opportunity. I just want to say a huge thank you to my colleagues who work with me on the scalp cooling program here at MSK, Andrea Smith and Ikuku Como. They're essential in this team, and it's definitely a team effort. And we collaborate with our interdisciplinary team members just to make this program successful. And we appreciate all your support.
Wonderful. Well, thank you so much.
Thank you.
The advertising messages in this episode are paid for by Paxman. Equitable access to scalp cooling is now within reach. Paxman's insurance-based billing model will unlock a new age of coverage and access for your patients. Are you ready? Find out more at paxmanusa.com/IBBM. Thank you for listening to the ONS podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.